It may be helpful to remind parents that a lag in nighttime dryness is common. Nighttime dryness lags behind daytime by a number of months for many children and by years for some. Nighttime wetting is not usually considered a problem until a child is 6 or 7 years old. Share with the parents that in order to make it as easy as possible, keep the house warm, dress him in pajamas that are easy to remove, light the way to the bathroom, and willingly accompany him if he calls out to them. Experts disagree about restricting the child's fluid intake in the evening. Some say that this tends to focus the child on wanting a drink and makes him more anxious. There is also controversy about waking a child to take him to the bathroom before the parents go to bed. Opponents argue that this doesn't teach the child to respond to their physical signals. Regardless of the approach, it can be helpful to make up the child's bed with 2 sets of sheets and waterproof pads to make nighttime accidents easier to clean up. If needed, they can strip one set and the next is already in place. It is important that the parent and provider decide together that it is time to begin toilet training. Sometimes a parent is anxious to begin the process. Other times, it is the provider that is ready to get started. Review the signs of readiness and decide together if the child is ready. Talk with the parent about how to proceed. Avoid requiring the child be trained for yours or their convenience. This denies the child the opportunity to get ready at his own pace. It may also lead the child and parents to become anxious over this developmental milestone. When the child is ready, use a plan of action to discuss how to proceed. Consistency between your approaches is especially important for the child during this complex learning process. If you or the parent notice that the child is experiencing difficulties such as pain or burning during urination, a weak or small stream of urine, consistently damp underwear, or persistent symptoms of diarrhea or constipation, parents should be encouraged to take their child in for a medical exam. Remember all of those steps that we mentioned? A child can be considered completely toilet trained when he is able to anticipate the urge to use the toilet, get there in time, pull down his pants, use the toilet, pull up his pants, and wash up after himself. For many, this is a complicated process that takes time to learn. Becoming independent in toileting is a complex task. Because of what we do, and because of North Carolina regulations if you work in North Carolina, there are other issues involved with toilet training. There are very strict procedures involved in toileting regarding health and sanitation. We're not going to review the steps in this session, but I have provided a handout as a resource that lists the steps involved with toileting as per the Mecklenburg County Health Department. A reminder also that North Carolina Child Care Licensing Rules and Regulations gives guidelines for supervision that must be followed even during toilet training. Supervision can become difficult in these classrooms during toilet training, particularly when there is only one teacher for many children at a time. Even though ratios allow for a certain number of children per caregiver, best practice may be that ratios are adjusted in consideration of the challenges that occur during toilet training. This is also provided as a handout for you to download. As teachers, planning and implementing the curriculum is one of your many daily jobs. During these years, toilet training naturally becomes a part of the daily curriculum. There are classroom activities that can be planned and incorporated into the curriculum that go along with the process of toilet training. Next, you have a required assignment that I ask for you to participate in. The assignment is to create a curriculum with ideas for working with children that are of the age that we have been discussing. Consider adding activities that promote self-help skills and independence, as well as activities that involve wet and dry.